Hi, this is Dr. Raj with Dr. Raj Plastic Surgery. Today we're going to be talking a little bit about rhinoplasty. I want to answer some frequently asked questions. So rhinoplasty surgery, or nasal surgery, some people call it a nose job, is essentially a surgery or procedure that can do two things. One is modify the appearance of the nose to try to improve it. And the second thing is, which I call the functional aspect, improve breathing abnormalities or difficulty. So when patients come to me for rhinoplasty surgery, they're either wanting one of two things or a combination. Either they're wanting to improve the appearance of the nose, there's something that they don't specifically like that they want to make better, or the second thing is they're having some type of breathing difficulty or obstruction, and they'd like the nose evaluated to see if anything could be fixed to help improve their breathing. And I do have patients that have a combination of both of those issues, and sometimes the aesthetic or functional concerns could be a result of trauma to the nose or some other issue that's occurred in their lifetime. So what I do with patients is I do a brief simulation where I try to show them what I can surgically achieve because patients may present certain pictures to me or desires or goals of what they're looking for, and I try to tell them what's actually possible with the rhinoplasty, and I want to make sure that that's in line with their expectations. So within rhinoplasty, there are two ways of doing it. One is called the open technique, the other one is the closed technique. The open technique involves a very small, well-hidden incision underneath the nose in order to lift the skin and do all of the steps of a rhinoplasty. The closed technique involves hidden incisions inside the nostrils in order to perform the same maneuvers. So a lot of patients wonder about the recovery. All of my patients that get rhinoplasty surgery, they do have a splint, and that stays on for a week. But even during that first week, they could return to work if they want, and they go back to kind of doing their normal routine. The only major restrictions are I don't really release patients to go back to working out or sports until everything is healed well, and that's the biggest restriction during the first few weeks of healing. So with the rhinoplasty, you can actually see the changes right away, but it actually takes 1 full year for all the swelling to go down and the final shape and contour to be seen. It gets better day by day and gradually as the months go on.